Hello, my name is Jennifer Kreimer, one of the Children and Teen Bereavement Counselors with Transitions Grief Care. This video will cover how to talk with your children and teens about an advancing illness. When and where is the right time to tell a child? You may keep waiting for the perfect time, but there's really not a right or perfect time. There are many moments of opportunity. Work to find the best time and safest place for you and your child. Walking, driving, snuggling. The earlier the better. If you've been talking about the illness for many months, this is a continuation of that conversation. If you are at the point where your loved one is dying soon, your children need to be told. What information to give? It can be helpful to start by assessing their current understanding by gently finding out what they know or have noticed. You may be surprised by their answers. You might want to say, Mom has had cancer for the last year. I'm wondering what changes you've been noticing lately. Or, what are some of the questions that you want to ask about what is happening with Grandpa? Or if you're the patient, how do you think I'm doing lately? You may even want to ask them, are you worried Nana is going to die soon? Often they are already worried or thinking about these things, and you can help them by naming it and saying it out loud first. Continue checking in with them about their understanding throughout your conversations, as it is helpful in clarifying any misconceptions that they may have. Avoid making promises, as tempting as this might be, such as, we may still find a cure, or she may still get better. Use instead, the doctors and Grandma are doing everything they can, but sometimes they can't make the illness go away, and that is hard. When giving more information about the changing nature of the illness, it's important to give the illness or disease a name versus saying sick, which can lead children to think that others or themselves might die if sick. Have children talk to the nurse or doctor, use books, online resources to help you explain and educate about the illness and death. Children also need to understand that the treatment plan has changed, that the medicines are no longer working. You might say, the medicines I've been taking to make this cancer go away are not working anymore, and the cancer has spread to more parts of my body. Because of this, my body won't be able to work like it needs to and is supposed to, and my body will eventually stop working, and I will die. Let them know the expected timeline, but don't promise this. Though we don't know for sure, the doctors think Grandma has about 6 months to live. Educate and prepare them for any changes that are happening. For example, let them know their loved one may be more tired and fatigued, that it will be normal for them to sleep more, or to expect the loved one to lose some weight, or possibly have changes in their pain levels, which the doctors are working hard to manage. Prepare them for any changes in mood, increased periods of confusion, agitation, or irritability, or if the patient's memory is affected, that their loved one may not recognize them or even remember their name. There may be more helpers and medical staff coming to the home. Let them know what their roles and jobs are and how they are helping your loved one and family. If hospice is involved, explain what that means. As the illness progresses and things change, you can add more information and keep children informed to help reduce their anxiety. When preparing children for a visit with a loved one that they have not seen for a while or is in a new setting, or if there have been significant changes since their last visit, it can be helpful to take a photo of the patient, the room, nurses, the facility, and share about the sounds and smells and other sensory information that they can expect. And to help empower your children at this time, they can choose a job that they can be responsible for, and maybe caring for the ill person or helping around the house, maybe reading to their loved one, massaging their feet, bringing a cup of water, taking out the trash. Just make sure that these are age appropriate. Schedules. Though it is recommended to keep their schedules and home life as routine as possible, changes in their schedule are very likely. Let them know ahead of time what these changes will be. And try to keep the number of caregivers for children to a minimum if possible. Reassurance. Reassure children and teens that they did not cause the illness, it's getting worse, or death. Sometimes kids with their magical thinking are worried that something that they did or talking about death can make it happen. Tell them this is not true and that they have not done or said anything to cause the illness or impending death. And sometimes it's helpful to remind yourself of this as well. Children must also be reassured that they will always be cared for, no matter what happens. Fears of abandonment are one of the most common fears and concerns of children. They need to know the regular daily needs like getting taken and picked up from school, having meals prepared for them, bedtime stories read, someone to cheer them on at a soccer game. These things will still happen. They need to be told who will care for them after the death occurs. Let them know the plans. And remember, take care of yourself as you are caring for your children and others around you. We hope this has been helpful, and we encourage you to review information in the links below and give us a call if needed. Thank you.